Hi, my name is Cynthia Roman Cabrera, and I will be discussing mental health within migrant and seasonal Latinx workers. First, I wanted to describe what the community is. Migrant seasonal farm workers is someone who has departed from their home to work a specific amount of time, generally around an entire season. And the United States Department of Agriculture approximates that about 2.5 to 3 million migrant and seasonal farm workers provide labor during those agricultural seasons. About 30% of farm workers live in poverty due to the nature of the lack of living conditions. They are at higher risk of susceptibility to depression due to situational stressors, things like these living conditions, workflow, and worries about legal status. Due to the nature of being a farm worker, there's a high risk in the population of exposure to numerous toxic substances, including excessive sunlight, heat, dangerous machinery, fumes, fertilizer, dust, and pesticides. The risk of cancer includes prostate, breast, stomach, and others. Here are some of the other odds ratios that we see due to toxic chemical exposure. Risk of cancer is difficult to measure in this community because of the migratory nature, because exposures to relevant cancer etiology occur years prior to the diagnosis, and it's difficult to link exposure to disease outcomes with any certainty. This community has, however, specific protective factors that allows the community to flourish and build resilience despite the conditions. Things like self-efficacy and social networking connectivity are indicative of protective factors and positive health outcomes in this community. However, low literacy, cultural barriers, poverty, documentation status, all have been identified as risk factors and accessibility to healthcare and social services and decreased health outcomes. As such, I chose to explore the community of farm workers using fundamental cause theory because Link and Phelan posited that individual risk factors requires contextualization by investigating those specific factors that create risk. And they argued that social circumstances such as socioeconomics, race, gender, and stress were the strongest indications for disease outcomes. And so, fundamental cause theory would argue that mental health within farm workers could be linked to structural violence due to increased immigration surveillance, individual insecurity, ethnic discrimination, displacement, job inequality, and colonialism. This can be broken down to the way structural violence impacts the impact of structural violence show up in the community. And some studies have actually seen that there's a need to differentiate between the stressors in communities because it impacts health differently. And so one study actually found that normative stressors such as normal life events versus context-specific stressors such as economic hardships actually positively associated with better health outcomes. And so this actually helps to understand how to identify culturally and transformative methods of intervention that take into account the systemic violence and oppression. Fundamental cause theory also suggests that these social factors are robust markers for causing individual mental health. So, in understanding farm worker health, I ran across lots of different intervention methods, but I think the most promising one was this promotoras-led cognitive behavior therapy, and what has been shown to be effective about this is because CBT has already been established as a effective treatment for reducing behavioral cognitions across the board for anxiety, depression, things like eating disorders. It's been tested over and over again. And so it is the most helpful when there is a strong social support present within the individual's lives, as it is in farm workers. And so promotoras have been used in other health settings because promotoras come from the community. They are Latinx health workers that help address individual and population health. A few studies have demonstrated the effectiveness of using promotoras-led health initiatives to decrease symptomology within the Latinx community. And so if there were to be an intervention to address mental health, specifically to depression and anxiety and stress, this would be a very good effort, especially if it's led by this promotora. And so discussing sort of this recruitment strategies, first I wanted to point out that within this community, there is a lot of distrust. And so actually there was some participants who have been recruited into intervention efforts in the farm worker community who have mistaken researchers or health promotion practitioners for Immigration and Customs Enforcement, or ICE, and refused to be part of research initiatives. And so this snowball recruitment is extremely important with this community. By virtue of being a farm worker, there is a general sense of lack of stability and chaos, and the geographic dispersion of the community. One study found that high levels of economic and environmental instability reduce access to reliable healthcare. This regards the importance of the sense of home and reinforces the existing racist and xenophobic notion that they are unwanted in the United States. And so there needs to be an effort to recruit and engage leaders within the community. To retain community members, it's really important to be flexible, right? This community is migratory. They're moving from one place to another. And so being flexible and meeting people where they're located is the best strategy for retaining the community. And things like multiple contact information from different family members is one of the best strategies for recruitment in this community and retaining. And so assessment in this community is specific to the individual and the system's impacts. And so we should be evaluating if the system has the capacity to support farm workers' health outcomes long-term, to identify if it's sustainable behavior and if change is able to occur. The literature explored methods that include social connectivity, social network, and evaluate improvements in farm worker health through that social network. It's also important to have a critical lens of that system's assessment. And so finally, identifying some of the stakeholders in the community is very important because we're looking at people who have strong ties in the community, including religious leaders, community organizers, and promotoras. Community organizers are people who are doing activism and advocacy-based work. So folks who are organizing marches, who are teaching the community this critical dialogue about individual rights. And religious leaders, because this community is extremely religious, or in the literature they have it has been shown that they are lean more towards Catholicism, it's important to engage the community in that way. Engagement in the community includes trusting the community, knowing that that's their stories. These are, they are the experts in their experiences. Creating intentional spaces where farm workers are able to communicate, connect, and support each other. And then at the last level is engaging community level leaders, policymakers, researchers, and farm workers in coalition to intersect the intervention efforts. And so thank you for listening, and I hope that this was helpful.